My name is Dan Burchfield, and I'm an oral and maxillofacial surgeon. About 10 months ago, I was diagnosed with prostate cancer. And when I asked my urologist how he thought I should have it treated, he said he would probably recommend a radical prostatectomy. But as a healthcare provider, I know there are frequently multiple ways to treat a condition. So I started doing my own research. I bought several books on prostate cancer. I got on multiple websites, and I even had consultations with several surgeons and radiologists, not only in the United States, but also internationally. One of the websites that I came across was Profound Medical, and on that website I learned that there were a couple of newer, more conservative procedures that were available to treat some types of prostate cancer. And those were TULSA-PRO and HIFU, both of which use high-intensity focused ultrasound to heat or ablate the prostate tissue and cancer tissue to get rid of it, rather than use surgery or radiation, both of which can have severe complications such as incontinence and erectile dysfunction. That website also led me to Dr. Scionti, who is an oncology urologist in Sarasota, Florida, and he has extensive experience in ablation-type procedures. So I sent the results of my scans and my biopsy reports to Dr. Scionti, who reviewed them and called me, and he said he thought I was a good candidate for either TULSA-PRO or HIFU. But he wanted to examine me, so I flew to Sarasota for a consultation, and I returned shortly afterwards for the TULSA-PRO procedure. The procedure takes about an hour and a half. It was done in a radiology center rather than an operating room, since it uses an active MRI to visualize the prostate and the area of cancer that's being treated. And it's done under a general anesthetic, so I was asleep for the procedure. Afterwards, I returned to my hotel room, and I had no nausea, no pain, no bleeding. In fact, I couldn't tell that I'd even had anything done if it weren't for the urinary catheter that I had in place and the small collection bag on my thigh, which was my good friend for about 2 weeks. Post-procedure, I've had no complications. I've had no issues with incontinence, and my sexual function has been preserved. My PSA pre-procedure was 5.29. My last 2 PSAs post-procedure have been 0.4 and 0.3. For all of us who get a diagnosis of cancer, it comes as a little bit of a shock and with a whole lot of decision-making as to how we're going to treat it. I think it's incumbent on each of us that get that diagnosis to do our own research, so that not only can we better understand the type of cancer we have, but the different options that might be available to treat it, so that we can participate in those discussions with the physicians that are taking care of us. In my case, my research led me to TULSA-PRO, and it was the right decision for me.